According to the U.S. National Library of Medicine, osteogenesis imperfecta, or OI, is a rare genetic disorder that affects 6 to 7 per 100,000 people worldwide. It is also known as the brittle bone disease due to the disorder causing bones to break easily with little or no trauma at all. When a person has OI, it is usually due to their body not making enough collagen to maintain strong bones. The National Institute of Arthritis and Musculoskeletal and Skin Diseases says that 85 to 90% of OI cases are caused by a dominant gene defect. The types of OI have increased over the years. It is up in the air exactly how many types of OI there are, but some say there could be as many as 11, but only 8 are currently recognized. Type 1 OI is the mildest and most common form of OI. Those with this disorder may only have a few fractures or dozens of fractures in their lifetime. The OI Foundation characterizes it as causing an average or near average height, muscle weakness, brittle teeth, hearing loss, a triangular face, loose joints, flat feet, and a possibly curved spine. In type 1, there is normal collagen structure, but a less than normal amount of collagen. People with type 1 tend to have a normal life expectancy. They also tend to have blue, purple, or gray tinted sclera. Type 2, on the other hand, is the most severe type of OI, often causing death at birth or shortly after. Those with type 2 tend to suffer from severe bone deformity, underdeveloped lungs with small stature, multiple fractures, and an unusually soft skull. Type 3 is the most severe among those who survive the newborn period. Fractures are often present at birth, and x-rays often reveal healed fractures that happened before birth. It is common to be shorter, have a barrel-shaped rib cage, brittle teeth, hearing loss, and poor muscle movement in the legs and arms. Those with type 3 may have anywhere from several dozens to several hundreds of fractures in their lifetime. Life expectancy varies with this type. My nephew, Bryson, has type 3 OI and suffers from many of these symptoms. He has had over 100 fractures and is only in the 5th grade. Continuing on, type 4 is a moderate type of OI characterized by easily fractured bones mostly occurring after puberty. They also have mild to moderate bone deformity, a smaller than average height, normal colored sclera, and once again, a curved spine, brittle teeth, hearing loss, and a barrel-shaped rib cage. Type 5 OI is very similar to type 4, but those with type 5 tend to develop hypertrophic calluses, which are just very large calluses, at sites of surgical procedures or fractures. Another big issue is the calcification of membrane between the ulna and radius, which restricts forearm rotation. Type 6 OI is an extremely rare form of OI. Those with this type have slightly raised activity levels of alkaline phosphatase, which is a gene linked to bone formation. It is unknown whether this form is inherited in a recessive or dominant manner, but researchers suspect recessive. Type 7 OI, in some cases, resemble type 4 and in others, type 2. Those with type 7 often suffer from coxivera, which is a deformed hip joint in which the neck of the femur points downward. Type 7 is also characterized by a shorter height, round face, and short arm and leg bones. Type 8 resembles the lethal type 2 and 3 in appearance and symptoms, except infants have white sclera. According to the OI Foundation, it is characterized by an extreme skeletal undermineralization and a severe growth deficiency. Unfortunately, there is still no cure for OI, but there has been many steps in the right direction. When it comes to treatment, the main focus is preventing or controlling the symptoms, caring for fractures, surgical and dental procedures, and physical therapy. Using wheelchairs and braces maximize independent mobility. It is a painful condition deserving of more recognition. Imagine rolling over in bed and breaking a rib. According to healthresearchfunding.org, there is a 7 times greater incidence of an overall fracture rate with those who have OI compared to the general population. Thank you.